Today, a group of frontline healthcare workers in Central Texas came together to talk about the lasting impact of COVID-19 and what it's done to patients.
It's those symptoms that persist even months after catching the virus. And KXAN digital reporter Grace Reeder sat in on a town hall today. And Grace, just from talking to people we know, a lot of people are long haulers and they deal with this.
Yeah, it's fairly common, especially among people who were hospitalized with COVID-19. The medical director for the post-COVID-19 program at UT Health said today that in a study done on mostly hospitalized patients, more than half reported they still had symptoms even 6 months after they got sick. One of those long haulers on your screen here, this man, Albino Hernandez, you might remember him. He's a beloved custodian for Eanes ISD. I've been checking in with his family, and today they told me that Hernandez is still dealing with pain and numbness in his legs. He has been out of the hospital since May. The good news, his family says physical therapy is helping, and doctors today said these symptoms that range from loss of taste to debilitating body tingles do appear to go away over time with the right treatment. That said, there's not a real diagnosis protocol for these cases, so it takes people advocating for themselves and physicians, frankly, being really willing to listen to those people to get them that treatment.
Yeah, and Grace, we've talked about some of these physical symptoms that can last for several months, but what about the emotional ones?
Yeah, the chief of psychiatry at Del Seaton said many of these long-haul patients are suffering from psychiatric symptoms too. From a study which has not yet been published, she reported that roughly 17% of people who got COVID reported anxiety months later, and 30% actually met the criteria for PTSD. She noted that there still is research that needs to be done to determine exactly what causes that. Is this the trauma of being hospitalized? Is it that people are experiencing a lot of stress right now in general? People are losing family members and friends or careers to this disease. The chief of psychiatry really urged doctors in this town hall today to screen for mental health conditions right now and help those people seek out the right specialists.
All right, Grace Reeder live in our newsroom. Thanks for the update. And to read more about today's meeting, just click on Grace's story at the front page at KXAN.com.